Now let's get some reaction to one of our top leading stories here on the channel. Nursing union DENOSA says the increased hospitalisation as a result of COVID-19 cases, especially in Gauteng, is putting a strain on its members. The province is currently the epicentre of the pandemic, accounting for 2/3 of the new cases in the country. Now, to discuss this further, we're joined by DENOSA's provincial chairperson, Simphiwe Gada. Mr. Gada, thank you so much for your time this afternoon. Now, Gauteng continues to record an increase in COVID-19 infections and hospitalizations. We've just heard now from the Premier, David Makhura, that he is concerned. Now, do you think the current restrictions that are in place are enough to deal with the rising numbers?
Well, thank you for having us. We advocated that earlier on that we should increase the COVID-19 restrictions in the province, precisely because we were trying to avoid what is happening and also trying to mitigate against the pressure that our hospitals are under. But after this weekend and also monitoring what is happening on social media, we think that we must do more, especially around the issue of pubs and clubs, because we continue to witness many super spreader events that are happening, especially in the townships and so forth. So we think that we want to once more make this call, especially to the law enforcement agencies, that as far as we're concerned, they're not visible enough. They're not enforcing lockdown regulations in the manner in which they should be enforcing them. I mean, in the first wave last year, we saw them, enforcing lockdown regulations. And for now, we don't see them, employing the same level of energy in enforcing lockdown regulations. So we think that our law enforcement are failing us in the fight against COVID-19 because venues continue to take more than the capacity that has been announced by the president and so forth. So we continue to see a lot of reckless behavior and the absence of law enforcement agencies. And that is putting a strain on our health system in the province. And our members, to be honest, we have been saying that the best gift that can be given to them is to exercise personal protective behavior. But the public is failing the nurses, all healthcare workers in the healthcare system.
Now, I'm hearing you say that the public is failing healthcare workers as well as the Gauteng provincial government that you are saying is actually not adequately prepared as well to deal with the crisis. Now, today, obviously, they introduced, the military medics into the system. We've seen them being deployed at the Chris Hani Baragwanath Hospital. We also know that the hospital has introduced the electronic hospital bed management. What's your reaction to this? Will it in any way ease the burden on some of your members?
Well, indeed, we welcome the deployment of the army into our healthcare facilities. We think that is going to assist us in terms of alleviating the pressure on our healthcare workers because they're already overwhelmed and overstretched, and they're also fatigued. I mean, they've been fighting COVID since last year. So we do welcome that, assistance. However, we think that one other thing that we must put forward, which should be done, is that we must then begin to assess the kind of healthcare services that we're offering. And we think that if we can scale down on some of the healthcare services that are being offered to the public, and that would also assist in terms of releasing more human resources towards the fight against COVID. For instance, there are certain services that we believe that which are not urgent, which during this period, during this third wave, up until there's stability in the healthcare system, we can put on the side and focus more on this fight without dismissing other health challenges that are there. But we think that those that are urgent, that are not urgent, can be put on the side to release more people so that we can be able to deal with this, especially around the issues of vaccination, because the challenge that our people face is that they must start at the queues to push vaccination. When things have normalized there, where they are vaccinating, they're then expected to return back to the clinic, back to the ward, where they must then do the normal duties that they do on a daily basis. So we think that that is overworking them, and the deployment of the army must be able to assist us to assign people to concentrate on vaccination. But another area that must be explored is the use of student nurses, student doctors in the vaccination drive, but not for free. Of course, they must be empowered and remunerated so that we can be able to push the vaccination drive. But also those nurses who remain unemployed, who are working through agencies, we think that we should be able to employ people that are going to specifically focus also on vaccination, because we all know that the plan of dealing with COVID is through vaccination. Once we are able to vaccinate a majority of our population, we'll be able to achieve herd immunity. We have seen in other countries where they've started returning to the, back to normal, where they're not wearing masks. And that is clear evidence that vaccines are working, and government should also place a lot of focus on vaccination. But also the public must not neglect the issue of wearing masks and so forth, because we know, we have got evidence that the wearing of masks does prevent the spread of COVID-19. I mean, healthcare workers continue to use the mask in the healthcare facilities, and thereby protecting themselves against the COVID-19 vaccine. So that is what we are pushing forward, that we must be, for us to be able to win this fight, especially in Gauteng, to stabilize the province, we need all the help that we can get.
Speaking about needing all the help that you can get, we understand even from this press briefing that was held by the Premier of Gauteng, as well as the MEC of Health in Gauteng, that there were some 5,521 personnel vacancies within the system, and these are also being filled in addition to the military personnel that is now coming into the system. Surely, don't you think that this now will assist, government deal with these rising COVID-19 numbers?
Well, it will assist, but the pace, there should also be a pace that is employed in terms of filling these vacancies. I mean, some of these people that must be employed are already in the system. Some came through the COVID-19 contracts. And it should really not be difficult that these posts must be filled. They should fill this post as urgently as possible. But of course, we know that when we say people must do things in an urgent manner, it opens room for corruption and for the breaking of certain legislations. But they should observe the rule of law in doing that. So it is going to make a difference. And it's something that we welcome as well. But it should be done, at the speed of a lightning, because our people are stressed, they are overworked, they are fatigued. Much as we appreciate that from last year up until now, there's a lot of experience that has been gained by nurses in terms of dealing with COVID and so forth. But we must remember that they are human beings. At some point, they need to be allowed to be able to rest, recuperate, and go back and defend the nation.
All right, Simphiwe, thank you so much for your time this afternoon and for just unpacking what DENOSA's viewpoint on this is. That was Simphiwe Gada, DENOSA's provincial chairperson.